Hi, Dr. Baumholtz, Baumholtz Plastic Surgery, and I want to talk a minute about something called the Brazilian butt lift, the BBL, very popular on social media and actually around the world. But let's talk a minute about what it is and what it isn't. So BBL, actually not necessarily from Brazil and not really a true butt lift. So what is a BBL? So BBL is liposuction and fat grafting for the purpose of creating a better transition from the low back to the top of the buttock cheeks, for the purpose of improving the shape of the buttocks, and then I'm saying plus minus projection. I'll explain that in just a minute. So there are a number of different shapes of the buttocks. There's the more square or blockish, there's a V, and then in the United States and around the world, one of the more desired shapes and what people are typically coming for in terms of a BBL is a more A frame buttock. Now, the reason I mention buttock projection is that BBL has the highest death rate of any plastic surgery procedure worldwide, and that is because in other parts of the world outside of the United States, people will take the fat that they harvest or that they get from the liposuction portion and graft it into the muscle. That's a great way to get a really round projected buttocks. However, big blood vessels live in the muscle, and it's also a great way to do harm to someone when you don't mean to. So in the United States, the two main plastic surgery societies, ASPS and ASAPS, have recommended that all of their members, this is what we do, all of their members take the fat that they're going to graft and put it into the fat layer. So you're putting fat with fat, like with like, that's a good thing. However, it does limit the ability to give truly good projection. What if you're a skinny person and you want more projection in the backside? Or you've done a BBL and you didn't get the projection that you wanted. Well, in that case, you may be talking about a buttock implant, and we can address that in a different video, but you may need an implant to get the projection that you want. So a BBL is good for, again, liposuction and fat grafting to make a transition between the low back and the buttocks and to alter the shape, ideally to more of an A-frame type shape or an apple, and then also to try to improve the projection of the fat that is grafted, that is moved from one part of the body to the other. Not every little bit of it survives. I think a safe answer is roughly 60% or more, 60, 70%, something like that, but certainly not all of it. If more does, that's great, but if we want to set realistic expectations, we say about 60 to 70% of what's transferred will be there at a year. Now, the surgery itself, typically outpatient, meaning you go home the same day, unless in the liposuction portion of the operation, we take off more than 5,000 cc's or 5 liters. Then another standard safety approach is to keep the person overnight to watch them in a hospital setting. Right? That's a pretty typical recommendation by, again, both societies, ASPS and ASAPS. Well, I hope that addresses some of the concerns that you may have about BBL and answers some of your questions and allows you to be a better plastic surgery candidate. If you'd like to know more, please contact me here at Baumholtz Plastic Surgery. Thanks so much.